It's always turned on. It's permanent though. It wouldn't click anything else. All right. That's it. Good stuff.
All right, hello and welcome to everyone. My name is Tracy Schmidt and I am running to be the MLA for Rossmere. So I've been out talking to a lot of folks lately. We've been knocking on their doors and we've been asking them about what matters to them the most. And here's what we've been hearing. We want our ER back and we want better health care. When the PCs closed the emergency room here, they left an entire community without health care. And the cuts and the closures have left Manitobans waiting for surgeries that they need, and that is disgraceful. Manitobans deserve better. When Heather Stephenson and the PCs closed the ER, Wab and the Manitoba NDP stood right here with the community. We were there when we gathered right outside this very emergency room, and we rallied against the closure, and we're still here. We will always stand and fight for the health care that Manitobans need and deserve. Under a Manitoba NDP government, you will not only get your ER back, you will get better health care closer to home. And to hear more about that, I am so proud to announce and introduce the leader of the Manitoba NDP, Wab Kinew.
All right, thank you so much, Tracy. Thank you everybody for being here today. How do you do? I'm Wab Kinew, and I'm running to be our premier so that we can bring a new ER to the Concordia Hospital, and so that we can bring more surgeries here to the Conc. It was just 4 years ago that we stood here with seniors and families. They were feeling scared, frustrated, heartbroken. In fact, we were just right over there, about 50 feet east of where we're standing right now. And there were seniors who were taking petitions down to Kildonan Place Mall. There were working people who were taking time out of their family time to put up signs. There were people from all walks of life who were demanding that Heather Stephenson and Brian Pallister reconsider their misguided plan to close the emergency room here at the Concordia Hospital. Well, to all those folks and everyone in Northeast Winnipeg and surrounding communities, I want to send a clear message to you that if our Manitoba NDP team is elected government this fall, you won't have to fight for better health care. You'll have a government that delivers better health care to you. So as part of this commitment, I'm here today to tell you that a Manitoba NDP government will build a new emergency department here at the Concordia Hospital. Importantly, we are also going to take immediate steps to bring more surgical capacity here to the Concordia site. Now, one of the things that we should recognize about the Concordia Hospital here is that the team of surgeons who operate out of the Conc are nationally renowned. The surgeons at this hospital are known across the country as being some of the best joint surgeons anywhere in Canada. But here's the thing. There was a huge limitation, a burden, a bottleneck put on their ability to serve you, the people of Manitoba, when Heather Stephenson decided to close this ER. The surgeons here lost the ability to practice to their full scope of ability. They lost the ability to do more complex hip and knee surgeries. They had taken from them the ability to do other kinds of joint surgeries. So you tell me, as the people of Manitoba, does that make sense to you? That you have nationally recognized surgeons here at the Concordia who are being prevented by the PC government from serving you, from helping to clear the wait lists when it comes to surgeries, when it comes to meeting the needs of you, the people, when it comes to healthcare? Well, that doesn't make sense to us either. And so that's why we're committing to this investment here today. We know that there's been a lot of mistakes along the way. They've invested only 45 million of the 120 million that's been announced when it comes to the task force. There's so much money that's being wasted on duplication in the bureaucracy under Heather Stephenson. And ask yourself, just how long seniors in our community are waiting to get the surgeries that they need. These aren't just numbers, as it seems to be for some people in the PC administration. Each of these is somebody who can't run around and do the fun things with their grandkids that they want to. This is somebody who needs to make extensive alternate arrangements just to get through their day-to-day lives. And that's just not right. And so that's why our team has a plan to fix the mess in healthcare that the PCs caused. And that's why a Manitoba NDP government will immediately invest in surgical capacity and let the surgeons here at the Conc do what they do best, which is to provide healthcare for you. In order to do this, we'll build step-down beds with a high nurse-to-patient ratio. These will also have enhanced monitoring capabilities that use some of the best technological advancements available to give you better care sooner. You shouldn't have to wait for hours in emergency. You shouldn't have to wait years for a surgery. You shouldn't have to fight for 4 years against a government that should be working for you just to get health care in your community. So while the PCs plan to make more cuts, we've got a plan to build. First, we're going to build our healthcare staff with our 3-step plan of retention, recruitment, and building for the future. And then we're going to build a new ER right here at Concordia. And at the same time, we are going to make the investments into surgeries to clear the surgical wait list. This new ER will allow you to get the care you need closer to home. The surgeries will help you return to the active life that you want to lead more quickly. And so on October 3rd, you can vote to get this ER built. You can vote to get surgeries done more quickly. And you can vote for better health care right here in Concordia and across this province. So our plan for health care will make life better together. Thank you. So I'm happy to take any questions that people may have on this announcement or on other topics.
Il y a des retards assez importants pour les chirurgiens dans la province. Est-ce qu'une partie de votre but serait de travailler avec le privé pour que ces chirurgies puissent se faire plus vite?
Notre plan, c'est d'investir dans le système public. Nous avons des médecins qui peuvent livrer des chirurgies ici au Concordia de manière de plus haute qualité de n'importe où dans le Canada. Et maintenant, ils ne sont pas capables de livrer ces services à cause des coupures du gouvernement conservateur. Ça fait aucun sens. On doit arrêter les coupures et puis investir dans des chirurgies de manière publique, comme ici à Concordia.
You just opened an operating room where the government did in Southern here in Concordia. Would that not address the desire for more hip and knee surgery?
What the PCs have never addressed is the fact that when they closed the ER here, they took away a nationally renowned surgical team's ability to do more types of joint surgeries and more complex joint surgeries. And unless we give those tools back to the surgeons, we're always going to be waiting longer and longer like we have under the PCs. Only the Manitoba NDP has a plan to work with surgeons and nurses and those on the front lines to get you the joint surgeries you need more quickly.
So what's needed to do those additional types of surgery? Is it done in the ER? Is that established?
Actually, we're going to take immediate steps to bring back this capacity even before the emergency department gets stood up. And so we're talking about an immediate investment within 6 months of us taking office towards building 6 of these step-down beds. Now, these 6 step-down beds will be an important first step to replacing that capacity that was lost when the PCs closed the ER here at the Concordia Hospital. What it does is it gives you a high nurse to patient ratio. We're talking about 1-to-1 care. We're also talking about enhanced monitoring. What this does is it allows the surgeons here at the Conc to deliver surgeries to people who may have more complicated needs, who may have other health conditions that make their situation that much more complex. When the PCs closed the ER here, we lost the ability. Considering these are some of the best surgeons in the country who work at the Conc, that decision never made any sense. And so that's why we're here to talk about an immediate investment to surgical capacity, along with our bigger picture plan to bring an emergency department back to Concordia.
Do those step-down units not exist already?
No, this is a service that has been lost here. It's something that does not exist. This is a new announcement that would bring new surgical capacity to Concordia, and we would take the shackles off the surgeons who work here. Some of the best in the country who right now are being prevented by the PC government from living up and delivering to their full scope of ability. We want to be able to allow these surgeons to do what they do best, which is to provide healthcare for you. Under the PCs, that's not happening. And so that's why we're announcing this investment. Immediately upon taking office, we're going to work with the surgeons to start chipping away at these long surgical waits, and we're going to give them the tools to do so, which include these step-down beds, which include the enhanced nursing resources, and then of course at the same time we're going to work towards building this ER.
What kind of timeline are you suggesting to reopen the ER? How much would it cost?
The ER timeline, so first of all, we're going to act immediately on the surgeries. 6 months, 6 beds, and that'll give the surgeons the ability to start dealing with the more complicated joint surgeries, to deal with patients who have more complex needs. This is how you start to chip away at the wait list that has ballooned under Heather Stephenson and the PCs. At the same time, we know that the first step to opening the emergency department is staffing. Once we hire those 300 nurses that the PCs cut from Winnipeg, then we'll be in a position to start moving ahead with an emergency department at the sites we're talking about, which includes the Concordia, but also the Victoria and Seven Oaks sites. In terms of budget, this is in line with the announcements we've discussed previously, budgeting up to $150 million capital cost, $4 to $4.8 million in operating.
Would this, since this would happen... This would happen within 6 months. Would this be part of that 4.8, or is that an additional?
This is money that we've earmarked out of the $125 million annual healthcare staffing initiative that we announced on Sunday. Yeah, just on the cost side for the operating.
Maybe just off the benefit of part of this news release.
Sure.
45 million of that 120 is going towards surgeries. Is there anything that you would cut as part of that 120?
I think what we're highlighting with this research we're sharing here today is that while Heather Stephenson and the PCs keep putting out these big press releases, they're not actually getting the job done. I think everyone in Manitoba can tell that because you're waiting longer to get the hip and knee surgeries that you need or that your loved one needs. But now we've got the data and the research that backs that up. Big press releases, a lot of rhetoric, but no action. So our team is here, strong plan, and immediately upon taking office, we're going to take action here at the Concordia to provide the more complex joint surgeries, to take the limitations off this excellent group of surgeons who work here. And that's how we're going to help address the wait times that you've been dealing with for far too long.
Under an NDP government, what would happen to the existing provincial task force in Florida province for surgical working with other governments to send exhibits out for surgery?
The announcement that we're making here today is about taking an immediate step here at the Concordia to fix one of the limitations on some of the best surgeons that we have working at a public facility anywhere in the country. It makes no sense that the PCs have put these limitations on this group of surgeons here at the Concordia, and we want to fix that immediately. So what we're talking about here is delivering surgeries through the public system immediately. And that's going to be our priority. In terms of the task force, we'll keep an open mind about working with them, but I think Manitobans know that we're not making progress quickly enough when it comes to surgeries. And so part of our commitment to staffing is resetting the relationship to healthcare staff. And we're going to say very clearly to those at the highest ranks of the healthcare system, if you can't improve staff morale, and if you can't clear the waiting list according to our team's timeline, then we're going to find people who can. Great. All right.
I wanted to ask you about,
Okay.
your thoughts on NPI's change in driver's test. They've lifted that requirement for students who have gone through the driver's test program. What do you think of that?
For me, it's always safety first. I'm a parent, and one of my children is supposed to start driver's ed next week. And as much as I want my child to get their driver's license, safety has to come first. Safety for my child, safety for everyone else on the road. And to me, we have to put safety first. And yet again, we have Heather Stephenson creating a strike that's disrupting our summers here in Manitoba. She could end it immediately, and she should take immediate steps to offer working people in Manitoba a fair wage.
So are you saying that current plan that will allow some people who've done the paperwork and give them the license before going on the road, are you saying that is not safe?
2/3 of young people fail their first driving test. So under the PC plan, not only are workers not getting a fair wage, but potentially folks who aren't ready to get that license will be given them. And so as a parent, for me, it's about safety. As a Manitoban, I think everybody wants to think about safety first. Like, what do Manitobans want right now? What do you want out of this provincial government? What are you talking about as we head towards a provincial election? You're talking about inflation. What's the best way to solve inflation? Making sure the working person out there gets a decent wage. You're talking about healthcare. We've got the plan for healthcare. We're going to fix it using the public system. And you're concerned about safety. And yet again, the PCs are taking steps which could potentially make things less safe here in Manitoba. So I really, really encourage Manitobans to think carefully about the vote that you cast this year. Vote for the Manitoba NDP. Vote for better healthcare. Vote for safer streets. And of course, vote for a more affordable quality of life. Great. Okay, merci beaucoup tout le monde. Thank you very much. Awesome.
Good
Nella?
to see you.
Yeah, likewise. Good to be in your neck of the woods, close by.
Tracy, good job.
I know it will be first reference.
I wasn't gonna add any personal comments about that.
If we could all squeeze into one quick photo. That'd be great.
Manello gets better looking each day. We've